Hi guys, Jamie the Osteopath here. I hope you're all well. I just wanted to talk a little bit about shortness of breath, and I also wanted to talk about the breathing mechanism and one or two exercises you can do to improve your breathing and your rib function. Now before we start, I want to identify some of the causes of shortness of breath. There can be organic causes such as lung disease, if you've got emphysema, if you've got chronic bronchitis or you've suffered from asthma. More current issues in today's news are the COVID-19 coronavirus, which is a viral infection which can affect the lungs, and also pneumonia, which tends to be more a bacterial infection. You can also get heart problems which can cause shortness of breath. So ischemic heart disease or heart failure can cause shortness of breath. Other things such as anemia, psychogenic causes, so stress and anxiety can create hyperventilation where we're not breathing in deeply enough and we're feeling like we can't quite get enough oxygen in, among other causes. Now, the purpose of the video is not to sort of diagnose the causes of shortness of breath, but just to be aware of some of the causes, and if you are concerned, please consult a GP for further advice. The purpose of today is to see with those causes whether we can actually naturally improve our lung capacity and our rib breathing patterns. Now, to my right here I have a bucket. Within the bucket I have a bike pump. Now, we have 12 ribs extending from our lower neck down to just above our navel. Now, the 6 ribs that sit at the top we'll call the upper ribs, and the 6 below we'll call the lower ribs. Now, the upper ribs tend to function in an up-down function, up-down motion, okay? And the lower ribs tend to function in more of a lateral motion, as you'd see with a bucket handle. Now, not only do the ribs expand out to the side, they also expand at the front here and lift up. Now, what you'll tend to find with a lot of abnormal breathing patterns is that we become upper rib breathers. So one of the first things we can do is try to relieve a little bit of the tension in the upper ribs, and we can do this by doing a simple upper rib stretch where we actually fold the arm on the inside or grab the table and take our head to the opposite side. We can do this for about 30 to 45 seconds. And if we want to increase or change the angle of the stretch, we can allow a forward flexion, a slight forward flexion of our head, and then a repeat of that same movement, so you get a diagonal stretch across those muscles. Okay, do that both sides and try to hold for 30 to 45 seconds. The second exercise is more an exercise to try to encourage us to breathe in more deeply into our diaphragm and our lower ribs. I'd suggest doing this on a flat floor. Make sure that you're not doing it in bed, because you'll actually get more feedback from a firmer surface. Okay, in this exercise what I want you to do is put one hand on your upper ribs and the second hand on your abdomen, just below your lower ribs. And what I want you to do is, when you take a deep breath in, I want you to bypass the upper hand and try to really expand through and push up through the lower hand, and try to make it as passive as possible. I'll take 3 deep breaths in and then you can follow. And I'll do one final breath with the hand out of the way so you can see the exact movement within the abdomen. Excellent. Now, in theory, you want to practice this deep breathing for most of the day. However, because we live busy lives and we get carried away with things, what I suggest you do that 3 or 4 times a day, and you take anything from 8 to 12 deep breaths in, and then just reset and come and do that 3 or 4 hours later. Hopefully with a bit of practice it'll become a bit more habitual, and both with a stretch for the neck and these lower ribs, you'll improve your lung function. So from a musculoskeletal standpoint, you're getting as much oxygen as possible. Okay, thanks for watching. If you want to leave any feedback or any comments, leave them below. Okay, bye.